During the nationwide lockdown, Mr. Sundararajan fell off a bicycle and fractured his left hip. The few hospitals that were open during the lockdown in Chennai hesitated to begin treatment because he not only had visible COVID-like symptoms, but he was also a diabetic with hypertension and heart disease. To avoid any unnecessary delay, the patient was referred to MIOT hospitals, which was open 24/7 to patients in need of emergency care even during the pandemic. Mr. Sundararajan was brought to MIOT on 20th May 2020. Though he had symptoms of COVID-19, he tested negative for the virus. Further diagnostic tests confirmed open TB, which was highly contagious. The multidisciplinary team at MIOT hospitals concluded that the patient's case was extremely complicated because, in addition to open TB, he also had diabetes, hypertension, and heart disease. Despite the challenges presented by his multiple conditions, the team decided to proceed with the treatment. Any more delay would have worsened his respiratory status. There was also high risk of bed sore and severe deterioration in his general condition because of his age. Though there was risk of infection to the team attending to the patient because of open TB, the senior orthopedic specialists at MIOT went ahead and performed total hip replacement surgery on his left hip. The pulmonologists and critical care specialists then took over and treated his open TB. After a week in the ICU, Mr. Sundararajan was shifted to the normal ward and discharged on 6th June 2020. Today, he is back home with his loving grandchildren, praying for the world to be free from COVID-19 soon so that they can grow up in a safer place.
இப்போ ஆப்ரேஷனுக்கு அப்புறமா எனக்கு கொஞ்சம் டே பை டே வலி குறைஞ்சி இப்போ ஓரளவுக்கு நல்லா ஒரு இதுவாக இருக்குது. இந்த மியாட்டில் எனக்கு டாக்டர்ஸ் ரிஸ்க் எடுத்து செய்தாங்க. இது மாதிரி எல்லாருக்கும் அப்போ நல்லா ஒரு சேவை பண்ணுறது உங்களே ஒரு அப்ரிஷியபிள் இதுவாக இருக்குது.
During the pandemic, all 63 specialties at MIOT hospitals were accessible to COVID as well as non-COVID patients. MIOT hospitals, extending our care at the time of COVID-19.